Good morning, students. Today we are going to discuss anatomy and physiology of cricothyroid. Among the intrinsic muscles of larynx, it is the only muscle that lies on the external surface of larynx. Right and left cricothyroid muscles are separated by median cricothyroid ligament. Contraction of cricothyroid increases tension in vocal folds. Cricothyroids act on cricothyroid joints to increase the length of vocal cords by tilting cricoid lamina backwards and pulling the thyroid cartilage forwards, thus producing tension in the vocal cords required for raising pitch of voice. That is why it is also called tuning fork of larynx. This muscle is innervated by external laryngeal branch of superior laryngeal nerve. To make things simple, let us first go to the osteology of this region. Thyroid cartilage, which is composed of two lamina which meet in the midline to form the Adam's apple. Thyroid cartilage has superior horn and an inferior horn. Inferior horn of thyroid cartilage articulates with cricoid cartilage to form cricothyroid joint. It is on this joint that cricothyroid muscle acts. Contraction of cricothyroid elevates cricoid and tilts forwards thyroid cartilage, thus increases tension in the vocal folds. Another cartilage involved in this mechanism is arytenoid cartilage, which is pyramidal in shape. It has an apex supporting conical corniculate cartilage. Its base articulates with cricoid cartilage. It has two processes. It has muscular process which faces laterally and gives attachment to the intrinsic muscles of larynx. It has a vocal process anteriorly giving attachment to the vocal cords. Contraction of the cricothyroid muscle increases tension in vocal cords. Attachments of cricothyroid. It originates from anterolateral part of the arch of cricoid cartilage and gets inserted on the inferior cornu and lamina of thyroid cartilage. The parts of cricoid muscle are it has a straight part and an oblique part. The main muscle acting on cricothyroid joint is cricothyroid muscle. It elevates cricothyroid arch and depresses thyroid lamina. Mechanism of action of cricothyroid. Cricothyroid acts on cricothyroid joint. Its contraction causes elevation of cricoid and tilting forward of thyroid cartilage. Thus, this produces high tension in vocal folds, which are attached on one side to vocal process of arytenoid and on the other side to the posterior surface of thyroid, thus producing sound with high pitch. So, cricothyroid muscles draw up arch of cricoid cartilage and tilt back the upper border of cricoid cartilage lamina. The distance between the vocal process of the arytenoid and the angle of the thyroid is increased. The folds are consequently elongated, resulting in higher pitch phonation. The action of the cricothyroid has been made simple in this diagram. To the vocal process of arytenoid are attached vocal cords on one side. These cords are attached to the posterior surface of thyroid cartilage. Contraction of cricothyroid muscle tilts thyroid cartilage forwards and elevates cricoid arch, resulting in increased tension in the vocal folds. Cricothyroid muscle is innervated by external laryngeal branch of superior laryngeal nerve, which in turn is a branch of vagus nerve. In this diagram, it is shown that from vagus arises superior laryngeal nerve, which divides into internal laryngeal and external laryngeal nerves. Internal laryngeal nerve pierces cricothyroid membrane. It is sensory and supplies mucosa of the larynx above vocal folds. Below vocal folds, mucosa of larynx is supplied by inferior laryngeal nerve, which is branched from recurrent laryngeal nerve. Mucosa over the vocal folds is supplied both by branches of internal and inferior laryngeal nerves through gallonous anastomosis. External laryngeal nerve passes over inferior constrictor muscle of the pharynx deep to the superior thyroid vessels and supplies cricothyroid. Cricothyroid muscle, as already said, tilts thyroid cartilage forwards and elevates cricoid arch, increasing tension in the vocal folds. Paralysis of cricothyroid results in increased length of the vocal cords or vocal cords become wavy, so less tension is produced in the vocal cords, resulting in low pitched sound. To understand the action of cricothyroid, let's go to this video. To understand the anatomy of note production by the vocal cords, let us go to this simple musical instrument. Presently, the tension in the threads of this musical instrument is high, so the note produced will be of high pitch. Now, if we reduce the tension in the thread, the note produced will be of low pitch. Lesions of superior laryngeal nerve can be unilateral or bilateral. In case of unilateral paralysis of superior laryngeal nerve, cricothyroid is paralyzed and there is ipsilateral anesthesia of larynx above the vocal cords due to the involvement of internal laryngeal nerve. The cause of this paralysis can be trauma, thyroid tumors, and diphtheria. Patient presents with weakness of voice with decreased pitch. Flapping of the paralyzed vocal cord occurs. Vocal cord sags down during inspiration and bulges up during expiration. Bilateral paralysis of superior laryngeal nerve. In case of bilateral paralysis of superior laryngeal nerve, there is paralysis of both cricothyroid muscles with anesthesia of the larynx above vocal cords. The causes can be trauma, diphtheria, neoplasms, lymphadenopathy, clinical significance of cricothyroid. Cricothyroid muscle may be injected with botulinum toxin for treating spasmodic dysphonia. This procedure is performed under electromyographic guidance. Let us go for a quiz based on this lecture. Which of the following intrinsic laryngeal muscles is visible on the surface of larynx? A. Cricothyroid, B. Interarytenoid, C. Transverse arytenoid, D. Posterior cricoarytenoid. A is correct option. In fact, it is the only muscle which is visible on the external surface of larynx. Which of the following muscles produces tension in the vocal cords? A. Cricothyroid, B. Interarytenoid, C. Transverse arytenoid, D. Posterior cricoarytenoid. A is correct option. Injury to which nerve does not produce low-pitched sound? A. Vagus, B. Internal laryngeal, C. Superior laryngeal, D. External branch of superior laryngeal nerve. Internal laryngeal is the correct option. Which nerve supplies cricothyroid muscle? A. Vagus, B. Internal laryngeal nerve, C. Superior laryngeal nerve, D. External branch of superior laryngeal nerve. Which of the following is the safety muscle of larynx? A. Cricothyroid, B. Cricoarytenoid, C. Transverse arytenoid, D. Posterior cricoarytenoid. Posterior cricoarytenoid is called safety muscle of larynx. Thank you for watching. Do not forget to like, subscribe and share this video.